Hi, everyone. For those who don't know me yet, my name is Megan Lebeda, and I'm a program developer here at Kirkwood Corporate Training. This is our November webinar and the last one of the year, so thank you so much for joining us. And today we have Megan Hammes leading her session, Building a 2026 Mental Health Playbook, Policies, Programs, and Benefits for a Strong Workforce. Megan Hammes is the owner and founder of Hammes Homestead and Consulting. In her business, Megan is primarily focused on providing mental health first aid training to leadership teams and work groups across the United States. With a 20-plus year career in employee worksite health and well-being, Megan is driven to make a difference by normalizing conversations around mental health. Megan cares for her own mental health by enjoying time with her family on their rural Iowa homestead and being sure to enjoy some time outdoors every day. And what a good day to be outdoors. So hopefully everybody can do that after the webinar. So Megan, I'm going to kick it right over to you.
Yes, okay, sounds good, Megan. Thank you, and welcome to all of you attending. Thank you for showing up today. So, like Megan said, I am Megan Hammes with Hammes Homestead and Consulting, and just want to talk to you today about workplace strategy around employee mental health and well-being. So, if no matter the size of business you are joining us from, I have noticed that a lot of people are kind of assuming employee mental health as a part of their work responsibilities. And so this is typically folks from human resources, folks from safety, folks from a traditional wellness team. And oftentimes it feels really new and intimidating because mental health is probably not something many of us were learning when we were, going to college or early on in our profession. So it can become really daunting. And I don't want it to be daunting for people. I kind of want people to feel really confident that they have a strategy for employee mental health. And as I go through today's content, a couple of things. I want you to use the chat feature and the Q&A feature, and Megan is going to help me stay on top of those for things that you want to add based on your own work experience, questions that you have. And I also want you to be sure to take notes or jot down things that you are already doing in your company and kind of give yourself credit for that. Because what I also notice is that many of the things that, companies are doing that are very employee first, they're not really thinking about it as a part of their mental health strategy. Maybe they're thinking about it as a part of their talent strategy, their recruitment and retention strategy, their great place to work strategy. And at the same time, it's helping with employee mental health. So kind of, count it, if you will. So really encourage you to do that so that you leave with a lot of wins written down, maybe a couple to-dos, but mostly leaving with confidence and things. So with that, I will start. And Megan, we're looking good, hopefully on the sharing the screen.
Looks great.
Okay, great. So yeah, employee mental health, you can think of it as a part of safety, performance, and productivity, and other organizational strategies. So, why we talk about mental health at work is a number of reasons: supportive culture, strengthen engagement, a competitive advantage. We know that 92% say that it is very important to offer supports for mental health at work based on a recent survey by the American Psychological Association. Having employee mental health strategy also helps with risk mitigation and legal responsibility. So, kind of no matter your goals for your company or your reasons, there are lots of reasons why offering mental health strategy for your employees is very, very important. So, we also want to acknowledge that the workplace is a huge driver of overall health. So, in some cases, it is a driver of our good health. We meet some of our best friends at work. We earn a paycheck at work, and it helps with our financial stability. Hopefully, we are sharpening our intellectual skills at work. Maybe we use math at work more than we might use it if we didn't have work. So, all of these really good, positive aspects of work help our health. And on the flip side, because we spend about one third of our time, one third of our lives at work, there are some ways that the workplace can contribute negatively to our health. And so I just want to kind of look at the chat and hear from all of you. What are some of the ways that the workplace might negatively contribute to our health? Good. Yeah. Burnout. That was probably Megan there. Yeah. Burnout may be due to intense workloads or relationships at work. What are some other ways that work might negatively contribute to our health? Mm, good. Thank you. So, stress, absolutely. Work culture might be contributing to stress or strained relationships. Good. And, the list goes on and on. Oftentimes, extreme work conditions, seasonal work, long hours, safety conditions, supervisor support, unclear expectations. I'm not even sure what I'm supposed to be doing, and I keep I'm given more work. So yes, lots of ways that this can challenge our health. So we know that mentally healthy employees are safer at work, they're more engaged, they're more loyal to companies. And untreated mental health challenges cost US employers billions annually in lost productivity, turnover, etc. We know from research that workplace interventions can show a measurable return on investment. So, all really great business reasons why we should be offering these programs at work. So, to just kind of level set, when we talk about mental health and mental health challenges, and why we're addressing them in the workplace, um, why we do that, I like to level set with talking about this health continuum. So we are all on a health continuum and we are moving along this continuum all of the time. And hopefully, everybody is feeling very well today. So that means, your body and your mind are feeling connected. We're able to be productive, take things off the to-do list, our relationships are positive, so on and so forth. It would actually be foolish to think everybody was falling into the well category today, but that's my hope. So, we're going to take our physical health as an example here and just kind of go along the continuum of becoming unwell. So, cold and flu season is fast approaching, or might even be here, especially if you have kiddos in school. But when we're becoming unwell, we start to notice little signs and symptoms that something might be going wrong. Maybe it's a sore throat, waking up at night, lots of different things that are signals that our body might be becoming ill. And then we have unwell or sick. And this is where we might go to the doctor, we might get a medication, but we're sick, we're unwell, and we're going to actively work on recovery, whether that's by staying at home, visiting with a medical professional, etc. But as we're recovering, we are going to take good care of ourselves so that we can hopefully get back to that well continuum. So I know this seems very, logical, but I also encourage us to think about our mental health in the same way, where we can see early signs and symptoms of a mental health challenge, and that might be becoming unwell, kind of starts to creep up on us. And then we also become unwell. So maybe there's a mental illness, a diagnosis of a mental illness, or a crisis situation, or we're not able to make it to work for a few days because we just aren't feeling well and we're not sure why. But also often missing from the conversation around mental health is recovery. And we want to make sure that employers know and employees know. Hopefully, they're learning through training or different resources that recovery is possible. So, a couple of things I want everybody to know if you don't already is that many treatment options exist for mental health challenges that can be tailored to an individual's values and preferences. So if Megan L. and myself have the same diagnosis, the way that we go about treating that and recovering from that might look really different based on our preferences and our values. But that's where our mental health professionals come into play, is that they can work with us on different treatment options. So, an illness or a diagnosis doesn't always mean one thing, like, oh, I'm going to get medicine, or, oh, I'm going to need to go to therapy. Those things might be true, but within those categories of medication and therapy, there's lots of different options for people to discover what works from them. Just like our physical health, with our mental health, prevention and early detection are very, very important for a successful outcome and recovery. So, we want to be able to identify and start to work on things early versus waiting for a crisis situation. So, when I talk with mental health professionals and people who are licensed to do counseling, they absolutely love to have appointments with people who are not in crisis mode. And they do very well working with individuals in crisis also. But they always say, there's no problem too small to come and visit with us. And if you're at all like me, you kind of have this mentality of, oh, well, my problem isn't great enough to take somebody else's appointment. I've heard that there's long wait times. I've heard that counselors are very busy. So they don't need to see me for my little thing that's bugging me. And usually professionals will tell us that couldn't be farther from the truth. Please stop thinking that way. We want to visit with people early so that we can really start to strip away some of the root causes and get to treating this mental health challenge sooner. Also, want everybody to know that recovery is possible. So, when somebody gets a diagnosis for a physical condition like cancer, we immediately go into fight mode and we're going to beat this and recover and remission. However, with mental health, again, that's often lacking from the conversation. So, we want to talk about the fact that recovery is possible. And sometimes this also looks like successfully managing symptoms. And so, this is also really important for the workplace to know, is that just because somebody has a diagnosis doesn't mean that they're never going to be able to perform at the level they were before. It just means we might need to have a plan in place to manage things. And unfortunately, sometimes despite our best efforts, early death does occur. And here with mental health, I am talking about suicide. And again, some of the trainings that I do around suicide prevention in the workplace are very, very focused on the fact that suicide is very preventable, but we can't stop them all. So we also want to keep that in mind. So while we can do things to promote getting connected with care and talking about recovery, sometimes despite our best effort, suicide will occur. And again, this is very in alignment with how we think about our physical health as well. All right. So, a little bit about prevalence, because I want everybody to know that mental illness and mental health challenges are very common. 20 to 25% of us. And so, just, doing the math on the call, that's probably between 4 and 6 of us in any given year will experience a mental health challenge. So, this is very, very common. And a couple of other notes is that only 41% of people with a mental illness use professional services anytime in a given year. So, despite knowing what we know about different treatment options that exist, many people are reluctant or don't, for whatever reason, get that professional care. Additionally, there's a delay in seeking treatment of about 9 years from the first onset of signs and symptoms of a mental illness to seeking treatment. So, using the chat before I move on, I would like to ask you, what are some of the barriers that you see uh, that many of us have to seeking out treatment when we might need it? So, barriers to seeking care. Absolutely. Yes. Stigma. So that's negative attitudes that we hold toward a certain condition. So around stigma, common things I hear are, well, I'm afraid of what people are going to think. I'm embarrassed. I'm shameful. Yep, hesitant. My problems aren't serious enough. Availability. We often hear about wait times, cost. Saw Megan write that. Time and cost. We're worried, I'm already struggling and stressed out. Now, am I going to be on the hook for some medical expense that I am not able to pay? You got it. Availability. So, you all know these real barriers that people are up against. So this is something too that in different mental health awareness trainings we talk about as gatekeepers, are what are ways that we can just kind of help, maybe not eliminate all of the barriers, but we can help remove some of the barriers for folks once we know a little bit more about their situation. So I know I got ahead of myself and flipped through this slide, but the Iowa Healthy Estate Initiative, which is one of the free resources I'll talk about at the end of this webinar, they use this graphic, which is mental illness is as common as a white car, because apparently every 4 to 5 fifth car is white, and I drive one myself, so I'm always thinking about that when I'm on the road. It's, I'm like, "Oh, white car." Mental illness is as common as a white car. So, we should just think about it like, hey, it impacts many of us, and we should not be ashamed to talk about it. So, if I could just wave a magic wand and give leaders the ability to not be afraid to talk about workplace mental health, or to talk about it in a way that's not stigmatizing. These are the talking points that I would want people to use. First is to normalize talking about our mental health. I think we all know people who have zero problems talking about everything around their physical health, their workouts, how their back is feeling today, whatever it is. We talk their GI issues. We have not a lot of problem talking about our physical health. I really want leaders to normalize, everyone has mental health. Every single one of us has a brain that's inside of our body. So we need to acknowledge that. And also acknowledge that it's very common to have a challenge. And we should not ignore the fact that work impacts our health, because we're there so much and we give so much to work. So whether it's impacting our health in a good or a bad way, we just need to be honest and say, work impacts our health. And then recognize that mental health challenges show up in ways we can observe directly or indirectly in others. And these challenges are treatable, they're common, but people have some very real barriers to getting help. So, all of those things y'all listed in the chat make it so that we're not good at getting help. There's a lot to overcome to want to seek out help. Early detection and intervention lead to more successful outcomes. Just like our physical health, when we catch things early, there's a lot more opportunity to intervene. That might mean less time away from work to manage the illness, better tools and strategies to manage a mental health condition, and better able to manage risk factors and less likely to die by suicide. And then finally, we also need to talk about it like it's very serious, because it is. Just like if we ignored signs that something was changing in our body and we never sought medical help or attention for that, that can become very, very serious. And so with employee mental health, it's much more than just, oh, this is a trend. It's no, this is really serious. When our employees are struggling, death by suicide could be an outcome of untreated or ignored mental health challenges. All right. So, some trends that are shaping 2026. Um, Gallup data shows that people are really feeling the stress of getting all the things done that life and work require. So, to allow our employees to thrive, there's a lot of different levers that we can look at to support not just the whole of a person, but the diverse needs of a workforce. So, whether that's singles, families, millennials, Gen Z, boomers, lots of different levers. And we'll talk about some of these coming up here soon. And this is where I really encourage you to, write down the wins that you're already doing, that you might not be thinking of, as that's already a part of your employee mental health strategy. And the US Surgeon General, up until a year ago, he had some very key landmark reports that came out, one on loneliness, one on workplace well-being. Those were in 2023. And then just last year on youth and social media. But as I read through the Surgeon General's report on social media and our youth, I think the youth could easily be stricken from it. It certainly impacts their brain development, but I don't think any of us who participate in the 24/7 engagement that is the smartphone and social media are immune from its negative impacts on our mental health. But these are all drivers of an epidemic impacting communication and relationships. And those are obviously things that are needed for problem solving and productivity in the workplace. And then finally, whoa, my having a little technical challenge. It looks like my PowerPoint is not responding. So hopefully I'm still live. But the third thing that is shaping 2026 is workers are expecting open conversations and visible mental health resources. Megan, how am I sounding?
You sound fine. We see the trends shaping 2026 page.
Yep. I'm going to stop sharing my screen so I can reshare because my PowerPoint's not cooperating. I apologize for that. I'll share again in just a minute. Hmm. Okay, I'm going to close my PowerPoint and reopen it, and hopefully that helps. Okay, while I do that, as I talked about the trends that are shaping 2026, I want to ask those of you in the audience, what are things that you're hearing about or that your company is focusing on either right now or looking to do in the future? Okay, it looks like I have it back up. So let me share my screen again. So sorry about that. Okay. And then I'll get to the chat. I see you put some things in there, which I definitely want to read. Okay, I can see. Good. You're still live. Um, tripled down on our EAP support. Amazing. We're going to talk about that. And we're trying to figure out how to normalize everything about mental health. Okay, great. Well, EAP is definitely one of the things that we're going to talk about. Okay, just let me do a little adjusting here and hopefully we can advance. Ah. All right. You know what, Megan? My next slide is poll question number 1. So we're going to go ahead and launch the poll and hopefully my PowerPoint can catch up.
Okay.
Poll question number 1, thank you,
Yeah.
is how confident are you in your organization's current approach to supporting employee mental health?
Mhm. And just a quick note, our polls somehow meshed together, so it's actually question 5. So don't submit it until you answer your second poll question.
Okay.
There you go.
Oh, okay. So question 5 is what people are answering.
Yes.
Okay. I haven't had a tech thing like this happen for a long time, so I'll just count my blessings. All right. So yeah, how confident are you in your organization's current approach to supporting employee mental health? And Megan, I'm fine if you want to close it and share whenever you can.
Alrighty. Then if everybody wants to, you can end your poll and submit, and we'll just make another one for that next one.
All right. Are you able to share the results?
It looks like no one submitted. Do we want to
Oh,
use the
shoot.
chat instead?
That's fine. So yeah, people can just put in the chat, I'm very confident. You can put whatever you want in the chat. Or you can say, we don't have an approach. That's why I'm here. Or I'm very confident. Very confident. Awesome. Somewhat confident. So good. Okay. That was like way quicker than the poll. Okay. Awesome. Well, all of you that say I'm very confident, I'm going to ask you to, help contribute some. So yeah, since we had a little setback, I'm just going to put this slide up here to gain some time because of my technology, but we're going to jump into this playbook. And I want to recognize, we talked about barriers to people seeking treatment, but there's also barriers to getting started on developing a plan. Some of the same ones, interestingly, time and cost, the stigma and difficulty around talking about mental health for some people that maybe haven't been trained. It's a new or unfamiliar topic, but that also leads to opportunities, right? So opportunities for leadership development and education, opportunities to use fabulous partnerships. We have so many resources in our state and around here. Valuable data or feedback on our efforts could help save a life and improvement with our talent strategy. So yeah, lots of barriers to getting started, but also lots of opportunities. And again, some of you said, hey, I'm feeling really confident going into the new year about the things we're doing. I am going to want to hear some of those examples. So we're going to think about 3 different areas or pillars to this annual playbook for employee mental health. So, an organizational assessment, that's going to be represented kind of by this house. And that's what we're going to talk about first. This includes our policies, our leadership kind of support and stance on employee health, and then our culture, which some of you mentioned can help or hinder our health at work. So, this organizational assessment, this is like the framing of a house or the bones. Without solid bones and foundation of policy, we really shouldn't take the next step to think about programs because, to use a phrase I've heard, that's like putting lipstick on a pig, right? If we don't have employee first culture, but then we try to do something on World Kindness Day or World Mental Health Day, employees are like, really? Like, we care about this now because you don't treat me like it. So, the first thing we'll talk about is policy. And then the next thing is mental health supports in the form of professional support. So, this is our employee assistance program and our covered benefits for our employees. And then finally, workplace mental health awareness trainings and events will round out the third part of the playbook. So that's primarily what I focus on, is going into workplaces and doing different education and awareness trainings. But one of the first questions I ask is, what do your benefits look like? Do you have an EAP? Just to kind of get a sense for, how much focus has been placed here, because we don't want to do an event in a company and not have the programs and the benefits to really back it up. All right. So, organizational assessment, and why I have the different dot points kind of looking like a box is like, hey, let's check these things off and think about them at your company as a part of employee first strategy. So, one of the number one things that can stress people out, cause them a lot of discomfort or disease with the culture are work hours, which contributes to workload, but work hours and schedule predictability. So these are key things that employees really need to have in place. Are knowing, and if work is seasonal and it's busier at times, that's okay. If an employee understands, hey, we're gearing up for the holidays, we're a retail operation, everyone's going to be all hands on deck. If they know that in May, June, July, so that they can plan, that's usually okay. They know it's going to be a sprint. But when it's, oh, by the way, everyone's coming in tomorrow, or you're going to get your next month's schedule on the first of the month, those are things that are very, very challenging for people. Additionally, workload. And this is something that really needs to be assessed for different types of jobs. Not everybody is in a leadership position where there's kind of this expectation of, hey, we get done what needs to get done. Sometimes that means more. Sometimes people are really looking for a start and a stop time. And so it's important to consider everybody when we're thinking about the workload. And then paid leave. So some of you mentioned cost to seek care for a mental health challenge, and also time. So our employees of all types need access to paid leave to tend to lots of different life things that are important. That might be their health, but that also just might be other things that are very important to them, whether that's volunteering in the community, doing a little intermittent flexibility to tend to needs of the family, like kiddo practices. And so that leads into the intermittent flexibility and time off. Different things are important to different people. And so, does our organization support some intermittent flexibility and time off for things that are important to people? And then finally, this is a biggie. And I know Megan and Kirkwood Corporate Training have done lots of different trainings on culture and values. And there's a lot that goes into this. But really thinking about, how do our workplace practices and services impact mental health? So that might be stress, relationships, people's purpose. Does turnover and exit data reveal anything about health? And then a really, I would say, pretty simple one that I'm guessing a lot of you do is, do clearly stated workplace values reflect concern for well-being of employees and supervisors? So I love it when I go into a company and they have their mission and their vision and their values, and they're about people and team, and maybe a little bit less about profit and customer demands. So I'm going to stop right here because I know a lot of you indicated, hey, we're feeling really good. And we're just kind of thinking about some pretty basic but impactful policies here. What is missing from this list? Because this is not all exhaustive of organizational policies that touch our employees. What else is really important that might be left off of here? And if you don't have anything, that's fine. I can keep moving on. Okay. So the next slide, staying on this topic, is not so much what to look at that impacts employee health, but a little bit on how to do it and who should be included. So putting on the hat of lots of different types of workers, and this is an exercise that shouldn't be left to just one person. So if you're human resources and you've kind of inherited employee health and well-being, um, you're not a diverse enough team. There needs to be representation from around the company, and I would include leadership in that conversation. But how are different employees impacted? And then schedule review meetings with key stakeholders to update on progress. So if we are looking at policies, we can identify a reasonable, thing is identify one or two key policy changes or possibly enhancements that we want to focus on at our company. And maybe it's just a portion that impacts a portion of employees, but where can we get a win without completely undoing or redoing things? And then, since I know you already do some of these things, remind employees that they exist. You already have paid leave. You do want people to use it. That's why we have it. It's to tend to their needs. Remind employees of the positive mental health supportive policies that are already in place. Okay, I'm just going to check the chat. Accountability, kindness, absolutely. Good. Yeah. Thank you for including those. All right. So yeah, I would say, is there anything that we can modify or act on in year one? And then maybe there's a parking lot of things we'd like to do, but that's just too much to tackle. Put that on a parking lot list for next year, and then be sure to schedule some reviews. All right, we're just going to keep moving right along. So that second area, those professional mental health supports, as we saw in one of the first slides, American Psychological Association says, 92% of employees are saying we expect some sort of mental health services at work. So are mental health benefits offered? Are they covered for the whole family unit at the same level as our physical health visits? And then probably most importantly, do employees know how to access? So if there's, it's open enrollment season, or many of you are getting through it, hopefully, and good luck with that if that impacts any of you. But it's more than just a one-page flyer in the benefits booklet, right? Like, do employees really know how to access? Oh, if I have to put in my company email, who's going to know that I access the resources? So be sure that if they're offered, employees really, really know how to access. Do they know that they can do virtual visits and in-person visits, et cetera, et cetera? And if you don't know, that's okay, because I will say a lot of companies aren't sure. They need to go back and look in their benefits booklet, and they're like, oh, yeah, it's right here. It's right here. But it's okay. That's why we pay our brokers or our partners, is just to ask questions like, let me understand. How does this impact me? How does this impact my family, my employees? So be sure to, really communicate for full understanding. And again, that's why we pay them to partner with us. And yeah, I think at minimum monthly, what we can do is communicate some unique aspect of our benefits proactively. And we don't ask our employees to, go back and look at your benefits booklet to remember. Also, have we identified local resources for our employees if a referral for mental health treatment is needed? And again, we'll get to a slide where I have a whole bunch of free resources, some of them focused in Eastern Iowa here. But as an employer, do we know where to direct people to if they need it? And then somebody mentioned we've tripled down on our EAP, which I'm major supporter of that. But do we offer an EAP? Not everybody does yet. If not, I would say start to ask some questions and explore and, put it on a list of discussion items with leadership to get one. And how you can go about doing that is make a matrix of what your company wants in an employee assistance program. And then when you're interviewing, you can kind of score potential EAPs using that matrix. I would just encourage you, don't take the first thing that's offered by a broker, because there's a lot of different employee assistance programs out there. So you want to find one that meets your needs. And then some of you have EAPs. I encourage you to communicate at least one aspect of your employee assistance program monthly at minimum. So if you're in charge of this, you might feel like, oh my goodness, I'm talking about this all the time. But the goal is to reach the right person at the right time. And, if you're communicating monthly, some people might get tired of that, but some people might be seeing it with fresh eyes for the first time, or the message was very specific to the need of them and their family. Proactively work with an employee assistance program on postvention planning. So, this is if a mental health crisis would impact our workplace, what are we going to do about it? Who's going to send out a message? What's the tone of that message going to be? What are we going to offer for our impacted employees? Since I started my business 2.5 years ago, I've had a lot of phone calls asking me to come in and do a training almost immediately after a suicide at a work site. And that is not what I do. I'm not a mental health professional. I am an educator. And unfortunately, these companies do not have a partner. They don't have an EAP. So there hasn't been any experience with postvention. And so that's really hard on a workforce and a culture. Um, and use your EAP yourself to be able to talk about it, to be able to promote it and advocate for it, and just kind of see, how does it work? How is this partner, treating me as I engage and go through their services? And if you're not happy, shop around. There is probably not a binding reason why you need to stay with a particular employee assistance program. So this is also something that a lot of people don't know, is they can go elsewhere if it's truly not meeting their needs. All right, so I'm going to stop right here after talking about our mental health supports, and we'll read things from the chat about what else have I not included, or what can you share from your company that you're doing as well. Somebody in the chat wrote we tripled down in our EAP, which again, I love that. If there's some specifics that you can share, please do. Yeah, I love that focus on flexible working hours. And that definitely fits in with kind of the policy and culture and how we do business. Um, Also, with EAPs and mental health supports, those are often available, outside of normal working hours. So that's a key education point, depending on your business. If people don't have a lot of flexibility or shift work, a lot of times those company EAPs, they have counselors available until 9 or 10 at night, which is a really needed, great feature for a lot of people. All right. So the third pillar, mental health awareness trainings and events. So this is, yeah, like the third pillar, and this is a majority of what I do through my work, but awareness trainings in the workplace should aim to do the following: normalize conversations around mental health, talk about stigma and its impact in the workplace. We're not going to eliminate stigma, but hopefully we can reduce it and open up conversations. They should focus on how to recognize signs and symptoms of a mental health or substance use challenge. Good trainings will discuss suicide as a terminal outcome and how to intervene in a crisis. And then training programs also should educate on referral resources, because I'm guessing most of us are not licensed mental health professionals. And so when we find ourselves in a helping role for a coworker, we want to know, where can we go? What's the next level of support for somebody so that we're never, going it alone, supporting somebody through a challenging time. So those are kind of, I guess, a little bit of a litmus test that you can do to say, okay, is this training correct? Because there's a lot out there. We looked at different workplace trainings, and ones that they recommend, because there's a body of research and evidence, are the ones that you see on the screen. So QPR, that's question, persuade, refer. That is a suicide prevention training. Mental health first aid, that is a training through the National Institute for Mental Wellbeing. That's a full day training. It can also be done over 2 or 4 days. And then assist. This is a very intense training that's 2 days in length, trained to really help people intervene in a crisis situation. There are other trainings out there. These are the ones on the SAMHSA advisory. And so as they might, come across your desk, I would just kind of do that little checklist of, what are we going to be able to reduce stigma? Are we going to be able to give people some practical skills to help people intervene if there is a crisis? All right. Yeah, anything here that people want to add? Any experience with mental health awareness trainings, or you want to share maybe what your workplace has done or is doing? Maybe some of you have done some of these trainings. Okay, we'll keep moving along. All right, so this is a little bit of a busy slide, and there is no need to like copy this or replicate this. This is just an example of kind of how you can build a 2026 outline for what are we doing as a company. And are there times where we really want to kind of elevate mental health and focus on it? Or are there times when we might really want to kind of be working on it behind the scenes? Um, so early in the year, kind of maybe setting a calendar for some training events and dates. What's our company going to celebrate? What are we going to focus on? Um, Anybody can find this, but there's a lot of different days and weeks and months that we tend to focus on different things. So I put some of the, I guess, biggies up here that companies might want to grab onto and focus on. April is Stress Awareness Month. And so this is, often something where a company might focus on ways that we can, help people with their stress at work, etc. May is Mental Health Awareness Month. And so we tend to see a lot of trainings in May, a lot of focus and really celebrating our mental health. I worked with a company earlier this summer, and they had gone through a month of May where almost every day they had something that celebrated mental health. They did an outside, it was like a garden walk. They had a garden near their headquarters. They did like a mindfulness garden walk. They did food trucks 2 days every single week in May. They had a kite flying day. I mean, they just had all of these things, and it was kind of all designed to, really celebrate and protect our mental health. So it's very, focused on protective factors. And then the other month I would highlight is September, which is National Suicide Prevention Month. If any of you work in the construction sector, there's a construction suicide safety week. And so it's very common in construction to do a stand down for different safety things. And so this September, we saw a lot of different construction companies doing a proactive stand down to focus on suicide and learn about suicide warning signs and how to intervene in the workplace. So that was really awesome. But yeah, just encourage you. Oh, okay. I saw just on the chat, what is a stand down? So this is a common safety practice that a lot of companies will do. A stand down is often done to do so for people on construction sites to pause work, to preventively and proactively focus on safety. So it's like an all hands focus, because if an injury happens on the job, there's going to be a work stop. And so it's a proactive way to practice the stand down. And it's really integrated into strong safety cultures. But now that mental health is being, we see this being woven in more to our safety cultures, doing a proactive stand down, because the unfortunate reality is that suicides happen at job sites and in some industries more than others. And if that happens, work is stopping. So it's kind of a really powerful and positive way to focus on the topic proactively. But yes, you all probably know this, but anytime you can weave mental health information into already existing company priorities, that's a win. It makes looking at a slide like this feel less daunting, like, oh, there's more to do, there's more to plan, there's more to focus on. It's like, no, let's just like weave that in to the Employee Appreciation Day. And maybe we're going to have a table with 988 materials, for example. Okay, poll question number 2, if you're ready, Megan. And this time you don't have to force select just one. I
Got
don't
it. Give
think.
me 1 second here and I will launch it.
Okay, thanks.
There you go.
So I think you can pick, oh, that's the first poll question. And if you
Well,
don't have it,
gracious.
Megan, if you don't have it, it's okay. Because I know that first one was kind of,
We certainly did have it. I don't know what
if
happened.
you don't, just tell me. And you know what? Everybody's really great at using the chat. So we could just do that again too.
We can't. It looks like that one's stuck with another one. So here, how about this?
Girl, yeah. Let's just do the chat. And it can be like A, B, C, or D, or yeah, just let us know what's your top priority for 2026 and beyond. Love it. Patrick, education. Good. So anytime we are building knowledge, an automatic outcome is we are going to decrease stigma. So we're all going to learn more and we're going to get smarter. It will make us better able to talk about mental health. It will make us more aware of how the language we use might be further perpetuating stigma. So education is never a bad thing. Okay, I'm going to keep moving on because we've got lots of free resources to share. And these are quick wins and free resources. But encourage all of you too, if you have some, resource share that you would like to do in the chat, go ahead. That's something that we do in mental health first aid training, is we do resource share, because a lot of times people in a community that the instructor might not be familiar with, they know more than the instructor does about what some free resources might be. So I'm a big fan of the Make It Okay campaign, from the Iowa Healthiest State Initiative. So anybody for free can sit in on one of their online Make It Okay trainings, where you just learn about the stigma around mental health and why it's okay to talk about it. That's where I got that white car image from. But you can also be trained to be a Make It Okay ambassador and deliver the training yourself. So if your company has somebody that's interested in this topic or is a very good speaker, they should become a Make It Okay ambassador, and then they can deliver the company training. 988 Lifeline. I'm actually going to put in the chat a link to be able to order free 988 materials in English and Spanish. So this is things like break room posters, brochures, magnets, wallet cards, but 988 24/7 crisis line for people who might be supporting somebody through a mental health challenge or for the people having a mental health challenge. And you can call, you can text, you can do live online chat. It's all confidential, it's all free. And then based on area code, you will be triaged to local support. And I'll talk about that in a minute. But I also want to give a plug for mindspring.org. And this is an Iowa-based company out of Des Moines, nonprofit, very small. But no matter where I am speaking to in the United States, I talk about MindSpring. And the main reason why is because MindSpring, it's mindspringhealth.org. Monthly, they do probably between 10 to 30 webinars on different topics surrounding mental health. They're outstanding. They're often over the lunch hour and they're on just lots of different topics. They're free, so you can sign up for the ones that you want to learn about that are of interest to you. And at their website, they have some very Des Moines, Central Iowa and national based resources as well. So I love them. And then locally, we also have Foundation 2 Crisis Services serving Eastern Iowa. So hopefully, if you're an Eastern Iowa based business, this is a resource that we can direct our employees to. Their headquarters is in Cedar Rapids. They offer crisis response via phone, text, and chat. And then they can help us determine the appropriateness for sending out a mobile crisis response unit. They also offer volunteer opportunities, which is great. NAMI has many local chapters and they do a lot of wonderful, wonderful things. We have a few very active chapters in Iowa. And one of the most awesome things that they offer around the whole United States are support groups for different topics. So people who are in recovery, families of people in recovery, family of people who are abusing substances, suicide survivor support groups. So just the need to have community and help you feel like you're not alone. And then lastly, I have a really unique one that I absolutely love, and it's called mantherapy.org. And this is really geared towards men. The website has a very humorous slant to it, even though this is a very serious topic. They have great videos and they have a wonderful free confidential screening, again, very geared towards men, called an 18-point head inspection. And the reason why I really love to talk about this is because 78% of suicides are working aged men. So there's a clear need within this population. And this particular group is very credible, but they've made it approachable. So encourage you to check that one out as well. And I know we are very close to 3 o'clock. But now I'm certainly happy to take any, questions through the chat, or comments. Would love to hear sharing about what you're doing, resources that you want to share in the chat. We can all learn together.
All right. Like Megan said, now's a great time to ask any questions that you may have. Of course, if you think of some later, you can always reach out to us and we can connect that question to Megan. I am going to relaunch our final end of session poll here. If you could please give that just a minute and give me just a minute to get it launched. You know what? We're just going to skip it because it's been giving us fits this whole time. So ignore. Thank you all for joining us today. If there's anything else you need from us, you know where we are. We're really excited that you joined us and we'll be back in January with our round of webinars once again. So thanks everyone. Have a good rest of your day.
Thank you. Bye.